The proper setup of the elevation pillow is included in the package insert that comes with every elevation pillow 2 set or 3 set. The anesthesia tech can set up the elevation pillow with its standard intubating pillow before the patient ever arrives into the OR. What we do recommend is that the elevation pillow is already in place and drop the back down 5 to 10 degrees before the patient ever arrives into the OR. So here we have our large patient, our model patient today, Quentin, 6'3", 6'4", a little over 300 pounds. Let's say he has his IV in place. Let's say he's a little bit sedated. Let's say it's even a bigger patient. Large patients, as we all know, have trouble moving as it is. What will happen with the back down position of the OR table is that the patient will be able to more easily transfer from the stretcher onto the elevation pillow, which is already on the OR table. So Quentin, we're going to ask you to come on over now to the OR table and to push yourself up a little bit higher. Yes, sir, right there. Good. And shift a little to your left. There we go. Good. Then we're going to take the back up or back down feature of the OR table, and you can see now that Quentin will elevate his head and neck. The 3 airway axes are much more aligned. Imaginary line from the ear to the suprasternal notch is far more parallel to the OR table, and we're ready to go. Again, it's a simple point, but dropping the back down feature of the OR table will facilitate your larger patient transferring over from the stretcher in a sedated state onto the elevation pillow and the OR table. In addition to the fact that you've dropped the back down feature of the OR table, if your patient is an obstetrics case and the patient's coming for a C-section, a very large patient coming for a C-section, of course, gals late in pregnancy, they have trouble moving anyways, but let's say you've got an epidural in place and the block is a dense block, an excellent block. To facilitate transferring that patient with their epidural in place onto the OR table, onto the elevation pillow with a roller. Again, drop the back down feature and the patient will appear to be parallel to the stretcher, and it facilitates getting that patient over onto the elevation pillow, onto the OR table.